Good afternoon, everyone. We're thrilled to welcome you to another exciting and inspirational episode of Concorde Conversations. This is an initiative by Concorde Medical Group to educate, empower, and encourage our community about our health so we can all live to our fullest potential. Today's discussion is new ways to turn the new year into a healthier you. It's a discussion about achieving a healthy weight. We know that losing weight is one of the most common New Year's resolutions. And today we're going to help you be that 1 in 10 who keep that resolution. Hi, I'm Dr. Catherine Weinberg, Director of the Adult Congenital Program, and I'm joined today by two fabulous and brilliant colleagues. Both of these doctors are board certified in obesity medicine. So we're joined by our amazing return guest cardiologist, Dr. Lauren Rosenberg, and introducing our outstanding gastroenterologist, Dr. Louise Barraza. Many of you have sent in excellent questions, which we will be discussing today. If you have any additional questions, please ask them in the chat box. We only have 30 minutes together, so we're going to try and go through as many as we can. But remember, we're giving general guidance. If you have a particular question about your health, we want to help you. So come in, talk to one of our amazing physicians so we can answer your questions and give your health the attention it deserves. All right, let's begin. Okay, Dr. Rosenberg, why is it so important to have a healthy weight? How does obesity affect our health?
So I'm a cardiologist, and from my standpoint, obesity contributes to risk factors that cause heart attacks and strokes like diabetes and hypertension. But it also, obesity and adiposity, meaning excess fat tissue, also directly affects the heart and can have direct effects on how your heart functions. So it's very important from a cardiac standpoint.
Dr. Barraza?
Yeah, as a gastroenterologist, I really found that a lot of the conditions that I commonly treat are made worse by obesity or having extra weight on your body. These conditions include everything from acid reflux, irritable bowel syndrome, abdominal pain, indigestion, and fatty liver disease, and very importantly, also the risk of cancers, including of the colon, pancreas, esophagus, and even breast cancer can be affected by this. So I just thought it would be a nice complement to treating the conditions that I commonly deal with.
I think that's great. So, Dr. Rosenberg, how much weight do I need to lose to improve my health?
So the good news is that really the studies show that you can have significant improvement in both living a longer life and preventing risk factors for heart disease if you lose just 5 to 10% of your body weight. So significant changes with just small changes in weight.
So small changes make a huge difference.
For
So,
sure.
Dr. Barraza, how do I know what my healthy weight should be? What is a BMI or body mass index?
That is a great question. I would say that the BMI is probably the most common tool that we use to tell what is an appropriate weight for a particular patient. The body mass index or BMI is basically a calculation that compares your weight to your height and tells us what range you fall in. A normal BMI is less than 25, and obesity is diagnosed when the BMI is greater than 30.
Okay, Dr. Rosenberg, how accurate is a BMI and what are alternatives to it?
So a BMI is really like a rough estimate of how, of where you fall on the weight scale. However, there are certainly caveats to that, meaning like if you're extremely muscular, you're going to have a high BMI, but you're unlikely to develop health consequences from that high BMI. There are also certain subgroups of people that BMI doesn't work very well for, like people of East Asian descent. But it's a good rough estimate of where your healthy weight should be. With that said, there are other things that we can do, like waist to hip ratio, that's helpful. And then there are more advanced things like DEXA scans and MRIs, but those are generally reserved for academic study and not done in practice.
Great. So you can find a BMI calculator on the web, so it's pretty easy to do. Dr. Barraza, is diet or exercise more important when you're trying to lose weight?
Another great question. In terms of, what will get you the most bang for your buck, I do believe diet is the way to go. Most of weight loss, if it is achieved through changes in your diet. Although we know obesity in general is a very complex disease, what you put into your body in terms of what you eat or drink compared to how much energy you burn is very, very, very important. So I think exercise is also very important, but in terms of weight loss, diet is the name of the game.
Right. I think like if you've ever been on a treadmill and you've watched the calories like very slowly tick up, you know that it's very hard to burn enough excess calories just through exercise to really lose weight. In addition to that, if you look at a little food label, you can easily eat 150 calories, whereas burning 150 calories is extremely difficult.
All right, Dr. Rosenberg, why is exercise so important, even if it doesn't help us lose as much weight as we want it to?
Right. So, I mean, independent of your weight, exercise is extremely important for health. It improves cardiovascular outcomes, totally independent of weight. You get decreased in overall body inflammation, which we're finding out more and more is extremely important for health. People sleep better, feel better. It's just a really, really important component for overall health and particularly cardiovascular health.
Yes, and it helps mentally as well. So, Dr. Barraza, sometimes people don't feel comfortable at the gym. What can we do if we don't want to go to the gym to exercise?
I think that's very common. Not everyone, the gym can be very intimidating, and not everyone feels comfortable in that setting. If that applies to you, there are very good alternatives. So one such method would be to work out outdoors. When it's not a blizzard or the weather is much better, working out outdoors, especially around New York City, there's a lot of parks and ways to be active outdoors, walking, jogging, etc. So I think that's one great option. Another alternative would be to do workouts that are based on an application or through YouTube or other internet websites. There's a vast library of exercises that you can do at home with equipment that you have around the house. And so that might be a nice way to get comfortable doing exercise in a sort of more private setting, and then possibly maybe in the future venturing into a gym type setting.
That's a great idea. And I think a lot of programs are free nowadays, and Silver Sneakers is wonderful for patients who have Medicare. Check if it's available to you. Okay, Dr. Barraza, how effective are weight loss shakes, supplements, and teas, and are they safe to use?
That is a very, very common question that I get all the time in my office. I do believe that there's a role for like meal replacement shakes or drinks. However, those are very specific circumstances. And when that is necessary or called for, it really should be done under the guidance of a registered dietitian or nutritionist, which we have available in our system. And in terms of weight loss supplements or teas, those do make me a little bit more nervous. In terms of the supplements, they're not FDA regulated. There's no regulation that goes into their development, and they very commonly have additives that can be harmful, particularly to the liver or other organs. I'll tell you firsthand, in the hospital, I've had several patients be on these types of supplements that have very severe liver injuries. So I would say it's best to avoid them in general, or if you're considering it, then have that discussion with your physician before you start any type of regimen like that.
So the U.S. News and World Report ranks the diets every year, and they said that the Mediterranean diet is number one. What exactly is a Mediterranean diet?
Okay, so this is sort of, we all imagine diets as food pyramids, thanks to the USDA. So the Mediterranean diet really is like a super healthy, whole food. It's really a plant-based diet, but not exclusively plants. At the bottom of the pyramid, you can see that the foundation is whole grains, whole wheats, really whole carbohydrates, and includes beans as well. And then above that would be fruits and vegetables. So those are that's the main foundation of the diet. Above that, healthy fats, especially extra virgin olive oil. And then fish and chicken for protein, and then other things in small amounts. So there's there's still room for eggs and dairy and even occasional sweets or red meat, but those are at the very top of the pyramid and are meant to be in sort of limited occasional amounts.
Okay, so what's the data? Why is it so healthy, Dr. Rosenberg?
So we've had a lot of, it's hard to do these studies because there's really two ways to do them. One is to sort of observe people who follow certain diets and see what their health outcomes are. And that's sort of where the Mediterranean diet came from originally. But we've also done some studies, following people who've adapted these diets and following their outcomes. And this Mediterranean diet really has the most evidence behind it as far as preventing heart attack and stroke. There's also evidence for, other plant-based diets, but again, this is really a mostly plant-based diet, in the way it's set up now.
All right, Dr. Barraza, what do you think about the commercial diets? Jenny Craig's, Weight Watchers?
Mm-hmm. Well, I think, commercial diets like Weight Watchers, Jenny Craig, and other programs like Newman, others certainly have been very helpful to some patients. I think the biggest upside to these types of plans and programs is that they really provide a structure. They give you guidance in terms of managing your meals, what's allowed, what's not allowed, and therefore it kind of takes the thinking or guesswork out of a diet, so to speak. Some of the programs also have a social and supportive element that people really enjoy. And so I think it can be the right match for the right patient. And that's what I think.
Dr. Rosenberg, a lot of diets tell us to eliminate certain foods. Which foods should we eliminate? Should we cut bread from our diet and pasta?
So my answer to that is there's really only one thing that I would say are never foods, and those are ultra processed foods, which are to recognize an ultra processed food. If you look at the label, you may only recognize one or two of the ingredients. So what they are is foods that one element was taken out of, like high fructose corn syrup with a bunch of preservatives, and they have unlimited shelf life. So those are the foods you really, really want to avoid. And I think that other diets that eliminate entire food groups are just both probably not healthy and also totally unsustainable. So no, you don't have to totally eliminate bread. I would never tell someone that.
Good. And sometimes I think when you allow yourself little cheats, right, it makes it a lot easier. Okay. What about, Dr. Rosenberg, what about intermittent fasting? A lot of people are talking about it. How effective is it?
The way that it's done in its current form, which commonly prescribed, is fasting from the evening meal until lunch the next day, does not cause excess weight loss, except that it limits calorie intake. So there's nothing special about it. It's just that you decrease calorie intake when you fast that way. There may be some evidence for the intermittent fasting in a way that the earlier meals are larger, and as you go on with your day and into the evening, there's little to no food during the later time periods of the day. So it's definitely not a magic bullet, but it can help with caloric restriction.
All right, great. Dr. Barraza, we talk a lot about weight loss medications, right? Are they safe? When do you use them?
So there are multiple medical medications for weight loss purposes that are both safe to take for a long period of time as necessary, and that are also FDA approved and regulated. We typically consider prescribing weight loss medications when patients were unable to achieve the weight loss goals that they set with their physician through diet and exercise alone. And in addition to that, for insurance coverage purposes, the BMI has to be above 30 or above 27 with other medical problems that are due to obesity or metabolic syndromes. These additional conditions can be things like high blood pressure or high cholesterol. And so those are typically the criteria that one must fulfill in order to be a candidate or consider weight loss medication.
Yeah, I think some of the especially newer weight loss drugs have been a great addition, in helping our patients achieve their goals. And we have a few different choices now with medications, so we can kind of tailor, the needs of the patient to what medication they should be taking.
Great. What about weight loss surgery, Dr. Rosenberg?
So we generally reserve surgery for people who have not been able to lose weight in other ways and who have very high BMIs. I think that weight loss surgery is a great option for a very specific group of patients, and the outcomes are really outstanding. And the surgical procedures have really improved over time. So certainly it's a great option for a very specific group of patients.
All right, Dr. Barraza, is a calorie a calorie? Does it matter where your calories come from?
That's kind of tricky. I would say yes and no. We do know that certain types of fat are bad, such as trans fats, and other fats are healthier, such as those in extra virgin olive oil or from avocados. So there are differences in terms of the types of fat and calories that we are consuming. That being said, very explicitly for weight loss purposes, the total number of calories that you take in during the day does matter. We should try to control the amount of calories we consume and put into our bodies and try to improve or optimize the number of calories that we're burning through our activities throughout the day.
Yeah, I think it's an interesting question too, just because the food that we eat is really complicated now. Like much of what we eat has a lot of different ingredients, and especially some of the chemicals that we just really don't know what they do from a biological standpoint. So I think that's why I like the Mediterranean diet, just because it really keeps you on like a whole recognizable diet with real healthy foods.
I always tell patients if you can't pronounce what's on that label, then it's probably not healthy for you, except maybe quinoa, which took me a while. Okay. How much weight should I be expecting to lose in a week, Dr. Rosenberg?
Yeah, so I think this is tricky. And I think anyone who's tried to lose weight knows that it doesn't come off like this, like we would like it to. I think slow and steady wins the race. So I would usually say a half a pound to a pound a week, with the understanding that it's going to come off faster in the beginning and that you're likely to plateau. And you may even go like this, and all of that is okay. So it's different for everyone, but slow and steady.
Okay, Dr. Barraza, can certain medications cause me to gain weight?
Absolutely. I think this to me is one of the most common aspects of weight management that completely goes overlooked by most or many physicians. Medications such as antidepressants, certain diabetes medications, hormone replacement, even antihistamines or others can be promoting weight gain and contributing. In certain circumstances, there may be weight neutral medications or even medication alternatives that promote weight loss. So that's always something that I focus on during my evaluations, is making sure I understand all the medications that you're taking and sort of seeing if that could be contributing to weight gain.
Great. Okay. Can genetics play a role in my weight, Dr. Rosenberg?
Yes, so certainly, genetics are a large part of what determines whether people become obese or not. But it's not everything. It's probably about 50%. So genetics play an important part in determining whether you'll become obese, but there is plenty of room for lifestyle changes and modifications to fight those genetic causes of obesity.
All right, so let's move on to the chat box for a little bit and look at some of the questions over there. So someone asks how to counter boredom with your workouts. They're not fond of the gym, but cannot play tennis due to an injury. What can they do?
I kind of encounter that sometimes as well. Just bored, I try to run and do other things, and it can be boring sometimes. in those times, I try to mix it up. I try to take a different class or do something out of the ordinary for me. I might do a yoga class or a bar class or some kind of high intensity training class. So I try to, when I'm feeling that sort of boredom or just lack of motivation, I try something new. And oftentimes I find it pretty fun and enjoyable.
Yeah. So I think also, if you enjoy exercise, that's great. But I also try to look at it as like something that I have to do. I look at it like going to work or taking a shower. Like these are just things that we have to do, whether it's enjoyable or not. And sometimes I think playing some little mind tricks on yourself, like, okay, I'm just going to do 10 minutes. And if you just do those 10 minutes, that's great. But often when you start, you can, force yourself to go a little bit more.
Okay, Dr. Barraza, what's a healthy habit that you incorporate into your daily routine besides exercise?
This is something that I also kind of talk to my patients a lot about, but just being mindful, kind of being present, being in the moment. It's very easy to just eat your entire meal in 5 or 10 minutes and be on your phone at the same time, have the TV going and everything. But I think it's a very different experience when you sit down at a table. You have the whole sort of process of sharing a meal with someone or even just on your own and just being mindful, like chewing thoroughly, taking your time. I think that's something that I think makes my meals much more enjoyable and also sort of help me not overeat or eat more than I anticipated or planned to. So just being mindful, being present in the moment. I think that's something that I found very helpful.
Dr. Rosenberg, do you have a suggestion for us?
No, I think what Dr. Barraza said is great. I think, just from a physiologic standpoint, your body or your brain doesn't realize you're full until, a bit after you're actually full. So eating slowly, drinking water with meals is really, really important. And I think sitting and having a meal and not just kind of picking here and there is really important as well. So just agree.
Got it. Okay, here's another question. Is it difficult to lose weight if you have PCOS, hypothyroidism, menopause, other disorders?
Yeah, sure. All of those mentioned conditions do make weight loss more complex. And I think that sort of circles back to what Dr. Barraza said earlier is that, it's important to work with your doctor to make sure that the medications you're on for treating those underlying conditions are either help contribute to your weight loss or at least weight neutral. So I think those conditions certainly make it harder to lose weight, but there are ways to kind of mitigate that as well.
So if you're having difficulty, come in for a full evaluation so we can help you with those issues, right? Okay, so how do you reduce binge and emotional eating? Any suggestions?
I think the first step for that is acknowledging that there is a connection. I mean, food is very comforting. It's something that we share with other people. It's something that, on a cold day, for example, it just brings a warmth to you and it comforts you. And so it's normal and natural to make that association. But I think the first step is just to acknowledge that there is a connection there and that it's counterproductive in terms of what your overall goals are. So first, just acknowledging it and then sort of taking measures to address the underlying cause, whether it be anxiety or stress, which is rampant, especially now during COVID days and everything like that, a lot of uncertainty. A lot of people, myself included, deal with anxiety and stress and things like that. So identifying, acknowledging that that's a problem, and then taking healthy measures to try to address that underlying stress, that underlying depression that we sometimes encounter.
Okay, here's a question. What's the best way to lose belly fat? Can you lose fat in just one area?
So the answer to that is really no. Unfortunately, as especially you age, people do tend to accumulate weight. The weight distribution just changes and it does tend to accumulate more in the midsection than it did when you're younger. I think exercise could probably play a role in that, changing sort of body composition, which exercise is better at than actual weight loss. So if I was going to recommend something, I might recommend something like strength training, Pilates, something like that, which really works on increasing muscle mass changing body composition rather than diet alone.
Okay, so Dr. Barraza, if you had one step to recommend to our viewers to improve their health and start today, what would it be?
I mean, yes, I think there's so many different things, even that we've discussed today. But I think if I had to just make one clear suggestion, I think that would be just to cut and or eliminate ultra processed foods. I think Dr. Rosenberg made a compelling point about how food is very complex. There's so many ingredients, we don't know what it is. But eliminating ultra processed foods and substituting perhaps a fresh fruit or vegetable or something in place of those little changes that we make on a day-to-day basis, those little changes will make a big difference over time. And so it just starts by cut that bag of chips out and eat a fresh fruit. I think that would be a great start.
Okay, Dr. Rosenberg, what's your advice?
So my advice would be just to set yourself up for success. And that would be get all the junk out of the house and avoid triggers. So in your house should be all the foods that that your best self eats, and get rid of all the garbage. Make sure that you have healthy snacks and healthy meals at home. Food prep if you need to. And I think if it's not there in front of you, you're less likely to eat it. So that would be my advice.
I think that's great advice. I know we have additional questions in the chat box. Unfortunately, we're running out of time. So thank you all for joining us for another inspirational and educational episode of Concorde Conversations. We know that many of you have additional questions and we want to help you. So come in for an appointment to see one of our amazing physicians so they can answer your specific question and help you with your health. We care about you, and thank you so much for joining us today.
Thank you.
Thank you.